Neuropathy, a silent enemy affecting nearly half of all diabetics without them even knowing it. It's the gradual damage to your nerves, leading to a range of symptoms that are often mistaken for everyday discomfort. In this video, we'll uncover the top 8 neuropathy symptoms diabetics miss, and the steps you can take to avoid them. Number 1. Numbness or tingling in hands and feet. This early symptom of neuropathy is often characterized by a sensation of pins and needles or numbness, commonly starting in the toes and fingers. These symptoms gradually progress, spreading to the hands and feet and making it difficult to feel pressure or temperature changes. The numbness is caused by high blood sugar levels damaging the nerves over time, which can disrupt nerve signals to your brain. Left unchecked, this numbness can lead to severe nerve damage, causing issues with balance, coordination, and sensitivity. It might even lead to unnoticed injuries since you're less likely to feel pain or discomfort in those areas. What to do? Gentle exercises like yoga, a simple 20 to 30-minute yoga session 3 to 4 times a week, stretching, or walking. Aim for 30 minutes of brisk walking at least 5 days a week. Can improve blood flow to the extremities, and controlling blood sugar levels is crucial to prevent further nerve damage. Number 2. Burning pain. As we continue, please subscribe to this channel if you're finding this video helpful. Thank you. A burning sensation, often accompanied by sharp or stabbing pain, is a hallmark of neuropathy affecting the sensory nerves. This pain often begins in the toes or feet and can spread up to the legs, hands, or arms. It may worsen at night, disrupting sleep, and feel like being burned, pricked, or pinched. This type of pain results from damaged nerve fibers sending inappropriate signals to the brain, misinterpreting normal stimuli as pain. Though it may start as mild discomfort, it can become more intense, limiting mobility and daily function if not addressed. Practical tip that can help: wearing loose clothing. Opt for loose, breathable fabrics that reduce pressure on your skin and allow better circulation. Using cold or warm compresses, while a warm compress can soothe and relax tight muscles. Alternate between cold and warm therapy for best results. Use each compress for about 15 to 20 minutes, and topical creams designed for nerve pain can bring temporary relief by dulling the pain signals. Apply these creams to the painful areas as directed, and make sure to wash hands thoroughly after use. Comfortable, cushioned shoes can reduce pressure on your feet, minimizing irritation to damaged nerves. Avoid shoes that are too tight or have high heels. Consult a healthcare provider for long-term solutions. Number 3. Muscle weakness. Neuropathy doesn't just affect your sensory nerves, it impacts motor nerves as well, which control muscle movement. You might find yourself struggling to perform basic tasks like gripping objects, holding a pen, or even walking upstairs without feeling fatigued. The loss of muscle strength happens because neuropathy affects the way nerves communicate with your muscles, leading to muscle atrophy or a decline in muscle function over time. You might also notice muscle cramping, twitching, or reduced muscle tone, particularly in the legs or feet, making movement less coordinated and more prone to injury. What to try? Engage in strengthening exercises, such as resistance training or low-impact activities like swimming. Swimming 30 minutes a few times a week can boost overall muscle health. Try exercises like leg raises, arm curls, or seated squats. Aim for 15 to 20 minutes, 3 times a week, focusing on low repetitions with good form to improve muscle function and coordination. A physical therapist can guide you on safe and effective workouts. Number 4. Loss of coordination. Lack of coordination, stumbling, or struggling to maintain balance can stem from nerve damage affecting your ability to feel the ground beneath your feet or properly sense your body's position. This happens because neuropathy interferes with proprioception, the body's awareness of where it is in space. As the sensation in your feet decreases, simple activities like walking or balancing on one foot can become increasingly difficult. This loss of coordination can lead to falls, making activities like walking on uneven surfaces or navigating stairs dangerous without support. Improvement tip: practicing exercises like Tai Chi or balance routines can improve stability. Start by standing on one foot for 10 to 20 seconds at a time, gradually increasing the duration as your balance improves. Perform this exercise near a sturdy surface for support. Repeat on both feet for a few sets. Simple actions like standing on one foot or using balance boards can also enhance coordination and reduce the risk of falls. Number 5. Increased sensitivity to touch. Known as allodynia, increased sensitivity to touch can make even gentle pressure or light clothing painful. You might find that brushing against your sheets, wearing socks, or even the touch of water during a shower causes discomfort. This is because the damaged nerves are overreacting to stimuli, sending amplified pain signals to your brain. Such sensitivity can disrupt your daily routine and impact sleep quality, leading to increased anxiety or stress over time as you struggle to avoid these triggers. Managing it. To ease the discomfort, use soft, loose-fitting clothing and bedding. Applying the cream before bed, before activities, and after bathing, it allows better absorption since your skin is clean and pores are open with capsaicin or lidocaine, may help soothe the irritated nerves. Use a pea-sized amount. Rub gently and avoid over-application. A doctor may recommend medications or lifestyle changes to manage nerve pain effectively. Number 6. Sharp or electric shock-like pain. Sudden bursts of sharp, shooting pain that feel like electric shocks are another common symptom of neuropathy. These can appear unexpectedly, often worsening at night, and can disrupt sleep or regular activities. This type of pain occurs because nerve fibers are damaged and misfire, sending exaggerated pain signals to the brain. This symptom is not only uncomfortable, but can be debilitating, causing an inability to focus and impacting your mood and quality of life. Relief options. Temporary relief may come from heat pads and ease nerve pain, while cold packs can numb the area and reduce inflammation. Use each for 15 to 20 minutes, alternating between heat and cold if necessary. Always place a cloth between your skin and the pad or pack to avoid burns or frostbite. Focus on stretches for affected areas, like calf stretches for leg pain or wrist stretches for hand pain. Regular stretching, 10 to 15 minutes, 2 to 3 times a day, can help prevent sudden pain spikes. For long-term relief, consult your doctor, who might recommend medication for neuropathic pain, vitamin supplements, or complementary therapies like acupuncture. Number 7. Loss of reflexes. A common yet overlooked sign of neuropathy is the loss of reflexes, especially around the ankles and knees. Reflexes are your body's automatic responses to stimuli, like when your doctor taps your knee to see it jerk. When these reflexes are diminished or lost, it indicates that the sensory nerves, which send signals to trigger these reflexes, are not functioning properly. This loss of reflex can affect your ability to respond quickly to sudden movements, increasing the risk of falls or accidents. Checking reflexes. Practice standing on one foot or walking heel to toe for better balance. Strengthen muscles with exercises like calf raises, squats, and leg extensions 3 to 4 times weekly to improve stability and reduce falls. Regular visits to your healthcare provider for nerve testing can detect loss of reflexes. Early intervention with physical therapy and exercises can improve muscle responsiveness and prevent further damage. Number 8. Poor wound healing. If you notice that cuts, blisters, or sores on your feet and hands take longer to heal than usual, this could be a sign of neuropathy affecting your circulation and immune response. Poor wound healing occurs when blood sugar levels remain high, leading to damaged blood vessels that restrict blood flow and oxygen delivery to the skin and tissues. As a result, injuries might go unnoticed due to reduced sensation and become infected or develop into ulcers. This is particularly dangerous for diabetics, as untreated wounds can lead to more serious complications, such as infections or amputations. Action plan. Conduct daily foot checks, especially for those with reduced sensation, and maintain proper hygiene. Consult a healthcare provider for wound care guidance, and ensure blood sugar is well managed to promote healing. Neuropathy symptoms can easily go unnoticed, but recognizing these signs early can make a huge difference in managing diabetes effectively. Stay alert to changes in your body, and don't hesitate to seek professional advice to protect your nerve health and overall well-being. You should also watch this video on other effective ways to manage high blood sugar. And please subscribe to this channel if you find this video helpful. Thank you for watching.